Johnson & Johnson announcement for next week. Can you tell me, for people that don't know, what is different about this vaccine that makes it different from the vaccines that have been offered so far in British Columbia? And you said you've heard from people who want it. Can you expand on that? Are there people in the healthcare system that will only get vaccinated with this particular vaccine, and people in the general public as well, and why?
Yeah, good question. And yes, the Johnson & Johnson, or Janssen, is their vaccine arm. Vaccine is a viral vector vaccine, so it's the same class or type of vaccine as the AstraZeneca COVID vaccine that we have had, but it is the trials were done as a single dose vaccine. So it's been widely used in the U.S. as a single dose vaccine, and it has good, strong protection, about the same as the 2 doses of AstraZeneca over time. So many people have contacted me. I would say there's probably estimate in a couple of thousands of people. Yes, we do know that some healthcare workers have said that this is the only option they would consider right now. I will say there's other vaccines in the pipeline, and we were very hopeful, for example, that Novavax, which is a more traditional protein subunit type vaccine, would be available before now, but they have had challenges both with their clinical trials and with their manufacturing and scaling up of manufacturing. We hope that that vaccine will be available, but sometime in 2022. So it will be an option for the future, but it's not going to help us get through this very critical period right now. So yes, I have heard from people, mostly I believe because it is a single dose vaccine, and that makes it you're able to travel, you're able to have your BC vaccine passport, etc. Having said that, in the U.S., Johnson & Johnson have just got approval for a second dose as a booster dose, and it is recommended by the U.S. CDC that people who got the Johnson & Johnson vaccine do get a second dose, a booster dose, after 6 months. But it's not yet applied for that here in Canada. And very importantly, if people, if they're holding out for this vaccine, we are very hopeful. We've been asking for it from the federal government in writing several times over the last year, but we're hopeful that we're going to get it in hopefully by the end of the week, early next week, and it will be available first for any healthcare worker who wants to use this as their way of getting back to work.